Welcome to the American Association of Critical Care Nurses Voices in Nursing podcast, exploring critical care nursing through meaningful and inspiring conversations. This episode is sponsored by the award-winning quarterly journal AACN's Advanced Critical Care, with information available at www.aacn.org/advancedcc. Now, here are your hosts, AACN's Chief Clinical Officer, Dr. Vicki Good, and Clinical Practice Specialist, Andrea Schmidt.
Welcome to this episode of Voices in Nursing. This is Andrea Schmidt, a Clinical Practice Specialist with AACN, and I'm joined by our co-host, Dr. Vicki Good, AACN's Chief Clinical Officer.
Welcome, everyone.
Before we get started, Vicki, I just want to let our listeners know that during the recording of this episode, we had some minor technical difficulties, so there will be a little glitch in the middle of the recording, but listeners will want to stick with us because this episode features a true legend in nursing.
I am just so excited about today's episode. It's going to take us down a path of our U.S. history and honors an incredible person who we all see as a true angel. It's hard to believe, but from 1900 to 1950, tuberculosis infection took the lives of more than 5 million people in the United States. Both the nurses and U.S. citizens had many, many fears related to TB, as there were so many unknowns with the disease. And I see a lot of correlations between that time and TB and what we all experienced with COVID. So I remember going to the grocery store in my scrubs, and people would look at me, very contemplatively, like, what are you doing here? And why are you in the store? And they would be scared because I was in scrubs. And I may not have even touched a COVID patient that day. Andrea, did you have similar experiences during COVID?
I did. I felt like I had to almost tell people if I was in scrubs, I haven't been near a patient today. Or if I was, I really tried to, I feel like, avoid people or change my clothes as soon as I got home. But I think also before masks became mainstream or mandated, as nurses, we're comfortable wearing them. And so I was scared, so I wore one, but I feel like we got weird looks from people also, every time we wore a mask. And so going back to the TB, Seaview Hospital in Staten Island was founded to treat and rehabilitate TB patients in the 1920s, but over time found itself with a significant nursing staffing shortage due to the fear of TB infection. So many of the nurses did not want to work at the hospital, primarily out of fear. This opened the door to recruiting around 300 Black nurses who were not afraid to step in and care for these patients. These nurses became known as the Black Angels.
Yeah, and Andrea, today we have the honor of interviewing one of the Black Angels. I've had the privilege of meeting Dr. Virginia Allen a couple of times in the last several months, and I just have to say for our listeners, we have an incredible treat for you getting to know Dr. Allen more. So, Dr. Allen, would you start out by telling us a little bit about yourself and how you became a nurse at Seaview Hospital?
Oh, good morning. I was born in Pittsburgh, Pennsylvania, and my parents moved to Detroit, Michigan because of the times. It was during the Depression, and I'm a Depression baby. I was born in 1931, and I was brought up in Detroit, Michigan. And I had an aunt who lived in Staten Island, New York, who was a registered nurse who visited occasionally. My family was very close-knit. My mother had 5 siblings, and of those siblings, and Edna Sutton Ballard was one of them. And I admired her so much. Of course, I think I was turned on by the white uniform and white shoes, and that was very appealing. And of course, she was a kind person. At the age of 16, I convinced my parents to let me move to New York to live with her, to go to nursing school. While I was waiting for nursing school, she suggested that I get a job at Seaview. And we lived not too far from Seaview Hospital on Bradley Avenue. So I walked up, put in an application, and was hired to work in the children's pavilion as a nurse's aide. And that's how I started working at Seaview. Very interesting looking back at those days now, and the training that I received from the nurses in orientation really gave me a good foundation for the nurses training that I would receive later in life.
I can't imagine what your parents felt like turning you loose at 16 to move that far away back then to start
Well,
this new journey.
I think they looked upon it as an adventure for me and an opportunity. I had just graduated from high school, and I would have been looking to go to college or do something with my life. And nursing was appealing because of my connections with Aunt Edna.
I admire your bravery leaving the house at 16 years old. I think that would be so hard. And then to be working in a hospital and exposed to all of those different things at such a young age, the sounds, the sights, the smells. It had to be a very interesting experience. But what I'm really curious about is nursing school was quite different when you were training. Would you be able to share what a typical day in the life of Virginia Allen, the nursing student, was like?
I attended nursing school through a special program that the Department of Hospitals had set up because of the shortage of nurses. Uh, this was a practical nurse program. It was a work study program. So you went to school in the morning on Welfare Island, and then you went to your respective hospital to work. This was citywide. All of the Department of Hospitals had the opportunity to send someone who had passed the test, an entrance test for nursing, to Central School. And this was a stepping stone. You get your licensed practical nurses by qualifications, and then you could go on to RN school or medical school, whichever you desire. So I would go to school in the morning, then travel back to Staten Island from Welfare Island and work on one of the wards in the evening. And that was really quite a long day. I think if they had really thought it out, it would not have been feasible. But I went through the 18-month course, never being late or absent.
Wow.
And at the end of my course study, I took the boards, the New York State boards, and passed with a high average. But unfortunately, I wasn't able to continue on as a higher education at that time because of my commitments that I had. I was self supporting. I had moved out of my aunt's home and I was living in the nurse's residence when I went to Central School. So when I completed my studies, I got my own apartment. So that was extra expenses.
Mm-hmm. What an amazing journey. And just you were dealing with so much at that time. And, as a reminder, this was in the 1950s. So not only were you dealing with this disease of tuberculosis that everybody was fearful of, you were also dealing with a lot of issues with racism. So will you share what that was like and, how you dealt with those issues of racism?
Well, when I first started nursing, I was not sophisticated enough to understand the racist part of some of the actions of different, um, the doctors, the staff, and patients even. It wasn't until much later in my nursing career, when I was working in the operating room, that I really understood the racist part of it, when doctors would not speak as they entered a room and you were there, and actually you were invisible to them. All they were interested in is your knowing what instrument to pass to them. And that was mostly my experience. But there were other nurses who were, I would say, disrespected by the patients, spitting on them or hitting them, or their speech. But I did not personally experience that.
It's just so sad because you have a heart of gold and you were treating everybody equally, and especially in light of the tuberculosis crisis. You were the one brave enough to step up and say, I will take care of these patients.
And it was a joy to take care of. I was in the children's ward, and it was a joy to take care of the children because they were totally dependent upon you. So you felt obligated to do even more for them. But I enjoyed it because I was young. I think I identified with them easier than some of the adults. And it was nice reading to them and comforting them, because children had a different perspective than the adults about being in a hospital. They were constantly asking to go home, and there were some children who did not have visitors because their parents were hospitalized, and other relatives lived far away, I'm sure. So they didn't have relatives to visit them. So the staff, like myself, were their visitors.
Heartbreaking.
Yes, it is. But you had to not feel sorry for them. You had to step in and keep them cheered up and read to them and play with them and make them feel as comfortable as possible.
Had to be difficult to make them feel like maybe you really weren't as sick as they were, so they could have some sort of a normal childhood.
Well, they didn't know they were sick. Children are not aware that they're sick. They're like any other child that's home. So you treat them as if they're in their home. They had regular school time. During the children who couldn't go off the ward for school, the teachers came on the ward to teach them. And they had other activities, such as going out on the solarium every day, because during that time, The only cure for tuberculosis was a rich diet, fresh air, and rest.
Mm.
So they got plenty of rest, plenty of fresh air, and great food.
At least they got good care and they weren't alone, right? That's
Yes.
so important. Being with the children and other patients before they had the cure, were you ever afraid that you were going to catch it yourself? And if so, how did you control your fear?
I was never afraid. At 16, 18, you're not afraid.
True.
Yes. I was more focused on taking care of the children and making sure that they, as my patients, were getting the best care I could give them. That was mainly the focus of all the nurses who worked here. Nurses, dietary, because it's a team.
Mm.
If you don't have the whole team working together, you don't give A1 care. And this facility, from that time till now, it's a nursing home now, is number one in New York. It's always been and it's remained the number one healthcare facility. And I'm proud of that. I don't know if you know it. I live here on the grounds of Seaview Hospital. In 2009, early 2009, I came with Jane Lyons, who happens to be a female, who was the CEO here at Seaview prior to Seaview closing. We came to the ribbon cutting of Park Lane. It was a reopening of the nurses' residence as a independent apartments. So I took a tour with the rest of the guests, and I decided, they've done a very good job of renovating the nurses' residence. Maybe I'll take an apartment there, which I did. And I'm in the apartment the second one. I moved from one to this one. But I like this one better because it's in an alcove. It's on the top floor. And I'm sitting in one of the little alcoves. You know how the attics are. But it's like in 7 dormitory rooms. I have a 1-bedroom apartment that's very comfortable. And I feel quite safe and happy that they renovated this beautiful building so that it can actually be used by many people. There are 105 apartments here.
I just love that you've come full circle. You started your career, at Seaview Hospital, and now you get to live on the grounds where you started and did such historic work. I really want to go back to some of that historic work that, your aunt was really primarily involved in, and then you got to reap the benefits and also learn from her. So Aunt Edna was a nurse at Seaview in the 1930s and 40s, and she was instrumental in the clinical trials for the drugs that were instrumental in treating TB. And we use both of those drugs now, streptomycin and isoniazid, or INH, because I probably said the drug name wrong, and my pharmacist and daughter and husband will not appreciate me saying it wrong. But how did she describe her role in those clinical trials? And what was it like to do a clinical trial back then when, we don't have all the computers and databases that we have now?
They gave the dosage of medication that the doctors prescribed. And at that time, you did all hand documentation. You had to observe the patients very closely, and the staff had to observe as well and report to the head nurse, who my aunt was, and they documented everything. So you spend time writing and actually observing the patients. And that was the information that the doctors used to compare how the patients were reacting to the medication over a period. And I must say, the patients responded to those drugs like a miracle. It was like night and day. And they were able to, some of them, be discharged after a year, 18 months. They could see them healing and getting stronger so that they were able to go home and take the medication. Not the streptomycin, but the INS.
Yeah, and I got to see at the chess conference where I got to meet you the first time, the historical documents and some of the documentation from back then. And it was just fascinating to look at the droves of documents that they generated and then manually looked at that data and analyzed it to make treatment decisions.
Well, that's all they had at that time. Now they put the information in a data bank and touch a few keys on a computer, and it all brings up the results for you. It was a long, tedious procedure, but they did it. And thank God they did.
Yeah, your aunt was certainly instrumental in that, and just amazing work.
I think of all diseases, and I think I'm so grateful for the research and the work that went into it, because there's a lot of diseases that have been cured because of it, and people have been able to go and live normal lives. So I think that's just the dedication, and it's wonderful.
Yes. And so few nurses or staff really got contaminated. I think it may have been because their immune system was very weak to begin with, or sometimes carelessness. All in all, I think the nursing staff and the supporting staff did very well.
So how did the nurses protect themselves back then?
Isolation technique, the same technique that's being used today. I still tell people, don't rely on gloves alone. Those gloves can have holes in them. Make sure you wash your hands well with soap and water.
Yeah. So what kind of mask did you have?
We had cloth masks and gowns. During that time, that was before the paper and plastic. It's sort of a combination, mask and gown. And we had a plentiful supply.
Virginia, I have a question. Since everybody that was there all had TB, were you allowed to wear the same gown and same mask for your whole shift, or did you have to change the way that we do now between people?
We changed. We did not use the same gown and mask for every patient.
So, for our listeners who may not know this, there was a book that was written recently named The Black Angels, The Untold Story of the Nurses Who Helped Cure Tuberculosis. It's by an author named Maria Smelios. And in the book, she describes how the TB often ravaged the bodies of those who contracted it. And obviously, as you mentioned before, once the drugs started working, especially the isoniazid, when the patients started to get well, what was it like internally for you to watch that change in them? from being so sick to leaving?
It was really a miracle because those patients were so fragile. Some of them could not even get out of bed. Some of them had lost so much weight. They were so weak. They were hardly able to ambulate. And many of them were bedridden. So the response to the drug was like a miracle.
Yeah, and I think one of the amazing things when I read the book, which if our listeners haven't read the book, it is truly a worthwhile read. The author does an amazing job of, really revealing the history of the era, what you were going through as an individual and your aunt, and just the personal story, as well as, the history, the development of the TB drugs. But I was just amazed at the spirit of the nurses and how dedicated they were. And, from what she reflected in the book, but I'd like to hear your perspective. It didn't sound like that many of the nurses got sick. And, why do you think that was the case?
I think because it was due to their extremely good training and the protocol here at the hospital. Miss Gillespie, one of the nurses, the nurse who ran the healthcare, the employees' health center, and other nurses.
Virginia, one of the most amazing things about the work that you all did with the TB patients was just how few nurses actually contracted the illness. What were the infection prevention measures and protective equipment like that you all used for these patients and for yourself?
Well, we had very good training, um, ongoing training on isolation technique and how important that was. And as long as you followed the isolation technique, wash your hands frequently, maintain that strict precaution between patients and your own well being. We were taught never to wear our clothing home that we wore in the hospital. We should always change. And we had lockers to do so. And I think that that was one of the reasons why so few nurses and staff contracted tuberculosis.
And as a follow up question to that, I'm curious, when you went home in the evening and your friends and family knew that you worked at Seaview taking care of TB patients, did they treat you differently?
No, but I am sure there were some who did, but we didn't. I didn't feel that in my family. My aunt was very cautious also.
Yeah.
She never wore her uniforms home.
Let's fast forward to the present. And you've been retired for many years now, but you haven't slowed down. Would you describe some of the ways that you've stayed active in nursing?
I worked until I'd say 2005. I retired from nursing in 1995 from Staten Island University Hospital operating room. My specialty really was operating room nursing after I left Seaview. I had a short bout of private duty nursing. I enjoyed that very much. It gave me an opportunity to go into the city and work with different types of patients. And then I went on staff at Brooklyn Jewish Hospital, in Brooklyn, which was a training hospital similar to Seaview, lots of doctors and protocol. I think I like protocol because I like to learn. And when you're working in a teaching hospital, there is always that excitement about something new to learn, a new procedure to follow. I was energized in my career, I think, because of that. So I've kind of been a lifelong learner and teacher because I did some teaching in the operating room. I was the preceptor for several classes of new nurses. As a matter of fact, I was the preceptor for Patricia Kane, who is the president and CEO of the New York State Nurses. We worked together. And there was always something new to learn. You know, with medicine, there's always something new coming up. And that energized me. And in the meantime, I also left nursing for a short time to go into labor, the labor movement. So I've had a wide, interesting career.
Sure sounds like it. So what do you do in your free time?
I belong to several organizations. I serve on a few boards. I serve on the board of the Staten Island Ballet, advisor to the Staten Island Museum, volunteer at the Schomburg Library when they're having a program that I'm interested in that I want to travel into Manhattan for. And I belong to the National Council of Negro Women, an organization that was started by Mary McLeod Bethune, and Dorothy Irene Height was the president and CEO for over 40 years. And there's over 2 million members in that organization, sections all over the United States. And I was instrumental in our founding of that organization here on Staten Island in 1968. And I'm still an active member of that organization. And I belong to the Lambda Kappa Mu sorority of business and professional women, New York State women. And that's a women's organization where I was a historian for several terms. So I'm not bored.
Sure doesn't sound like it. It sounds like you have a very full and meaningful life.
And Virginia, I mean, you've just led an amazing life of service to humankind and to your community, which is amazing. And I know you've shared with me personally when we visited your responsibility that you feel to share the story of the Black Angels. And so, what do you want our audience to leave this podcast knowing and understanding about the Black Angels?
Well, these were women who accepted the charge and opportunity, because when they came here to Seaview to work, hospitals were segregated. And unfortunately, many of the well-trained nurses were not able to get jobs in quality hospitals. And at that time, probably nursing homes, but not on the scale that we have them now. But they did leave their homes to come here to Seaview, to a place where they could make a decent living and have some opportunity to get ahead. And many of the nurses who worked here got married in New York, Staten Island, bought homes in the neighborhood. My aunt was one of those nurses. It was an opportunity for a better living.
Virginia, I think that we've had an amazing time together here today, and it's really been an honor to have you as our guest. And I'm really glad that we can share your story with our listeners because I think it's a very important story, but it's not a well known story that is part of our nursing history. When I personally think about this story, I think about, because it's not well known, I think about the movie Hidden Figures. But I think of this as the hidden figures of healthcare, and people need to know about it. I really think the words that come to mind of the nurses who answered the call was courageous and altruistic. And so I thank you and the other Black angels for stepping up and putting your lives at risk to save others.
And I'm happy that I am still able to converse with you. I feel really grateful that I'm able to represent them. I'm sure they're thankful also that they're being recognized after so many years of just being pushed aside because Dr. Robichek and his staff receive worldwide recognition, but those nurses were not given the proper credit they were due for their hard work and perseverance and sacrifice too.
Definitely. And in the patients that were all helped, I'm sure very, very thankful.
That's why they called the nurses their angels. And of course, we have all kinds of visions of what an angel is. And it's an honor for me to be called the Black Angel.
I think that is amazing. And we can't thank you enough again for being here. And so thank you to our audience for joining this episode. We would love to hear your feedback on this episode and ideas for the future. Please connect with us at podcasts@aacn.org.
Thank you for listening to the American Association of Critical Care Nurses Voices in Nursing podcast, proudly sponsored by AACN's award-winning quarterly journal, AACN's Advanced Critical Care, with information available at www.aacn.org/advancedcc.